It's 8 o'clock. We'll call the May Board of Health meeting to order. For the record, there is a copy of the Open Meetings Act on the back walls there in that sectional room. Also, for health purposes, there's an automatic defibrillator on the wall back there if somebody needs it. For that, and now we'll call to order the meeting. Sunday.
Okay. McNally. Here. Rogers.
Here.
Wade. Here. Weiss. Here. Ben Gray.
Here.
Celine. Here. Kurt.
Here.
Simon. I'm so sorry. Espinoza. Here.
For the record, I do have the official notice of publication. Item 2 is approval of the April minutes. Is there a motion?
Motion approved.
There's a motion, a second.
Second.
Roll call.
Rogers.
Yes.
Wade.
Yes.
Espinoza. Yes. Wilkin. Sorry. McNally.
Yes.
Weiss. Yes. And Gray.
Yes.
Item 3 is a public comment. I see no one here wanting public comment. With that, we'll go on to item 4, which is approval of the action items. There's items A, B, and C. Is there a motion to approve those items?
So moved.
There's a motion. Is there a second?
Second.
A second. Roll call.
Gray.
Yes.
McNally.
Yes.
Rogers.
Yes.
Espinoza. Yes. Weiss. Yes. Wade.
Yes.
Item 5 is issues for discussion and the coronavirus update. Dr. Paul.
Good morning, board members. Can you hear me? I guess so. So first of all, I would like to talk to you a little bit about the data in regards to COVID-19. As of yesterday morning, actually the latest data that we have now a total of 2,570 cases in Douglas County. When you look at it for the state of Nebraska had last night on their dashboard, 10,846 cases. So Douglas County has 25% of those cases. When we look at the age range, again, I always like to see who is really most affected by this. We see 51% of our cases are in the 25 to 49 years old. And the next highest one is 50 to 64, 23%. We have 13% of our cases in 5 to 24. And the lowest number is, the percentage is above 65 years old, we have 9%. So that is good news. We are seeing that the cases we are seeing in our community are mainly middle-aged working individuals. When we look at the rate per 10,000, and that is usually a measure that I think is a good measure, across the U.S., there is 46 cases per 10,000. That's kind of the average overall in the United States. In Douglas County, we are at 45 cases per 10,000. When you look at some of our counties that we know have been really affected by this in Nebraska, we see Hall County at 233 cases per 10,000, and we see Dakota County at 737 cases per 10,000. So compared to the 45 cases that we see in Douglas County. When we look at race and ethnicity, I think you have heard me talk about this. It is really important in public health that we try to see who is most affected by a disease, or in this case, by this outbreak, by this virus. And we see 48% of our cases are in our Hispanic population. Of course, I need to tell you, only 12.8% of that population, it makes up our community. So we are seeing that community is disproportionately affected. They have 4 times higher cases than they actually are represented in our community. That's important because if we need to do measures or interventions, that's where we want interventions to occur, to really try to protect that community. Our next population is in our Caucasian. We have 17% of our cases in our Caucasian community. Asians make up 15% of our cases. However, if we look at it in regards to what they are making up, they only make up 4.2% of our community. So again, disproportionately affected by this. African American make up 10% of our cases, but in reality, they are 11.4%. So that is good news. We see a community that is a little bit less affected, or at least closer to what they are represented in our community. Native American, the same story there. 1% of our Native American population is affected. However, they make up 2.5% of our total population. So we are seeing a decrease in that. It is important, and I know, I always am transparent with the data that I want to share, and I'm transparent with this too. Not really to point fingers by any means to a community, but to say we need to embrace that community and we need to see that resources go to that community. So when we look at it, I look over the last 3 weeks. The last 3 weeks have really seen an increase of cases in our community. And the highest positivity rate actually has been last week. Also, however, on the good side is we also have seen the highest number of testing being done over the last 3 weeks. And I think more testing we do, more are we identifying cases, and more can we do contact tracing and isolation. So that is really important to us. So total case numbers, because I get questioned a lot, how many tests have been done in Douglas County? We have a total of 18,083 tests that are being done. That is potentially 3% of our population. That's not where we want to be, but I think we need to start measuring and say, okay, this is where we are now. Hopefully more testing is going to come into our community. When we look at it, how many tests have been done in Nebraska, I looked at it, 72,333 tests. So 25% of those tests have been done in Douglas County. I think we always need to compare that. When we look at the positivity rate last week, I just told you we have done more testing. And what does more testing do? It identifies more individuals, but also potentially can bring the positivity rate down. That's what we have seen last week. So the positivity rate last week was 11.6%, and compare that to the 2 previous weeks where we were at 22%. We also do a calculation which means the doubling rate. How long does it take for the case rates to double? And our staff calculates that on a running average, and we now have 10.8 days it takes for our cases to double. When we talk about testing, and I think we all hear about where is testing going on and so on. Testing is going on at private healthcare providers. So if individuals have symptoms, they should call their healthcare provider, and they should be able to be referred to testing. So that's number one. Number two is Test Nebraska, which is this implementation that the governor has put in place, and it started on the 12th of May of this month. Started in Omaha. Omaha had the first site at the Civic Center, and you have heard about it at the parking lot. So far, Test Nebraska has done 2,475 tests, and they have had 57 positives in our community for a positivity rate of 2.3%. So that is the second side. The third that you have heard us talk about is the National Guard. So through some requests through the governor's office, the National Guard came to South Omaha because One World, honestly, was overwhelmed with individuals who wanted to be tested. So the National Guard has been here on the first day, which was last Thursday. They tested 206 individuals, and we have those tests back. 40 of them were positive, a positivity rate of 20%. We did testing again on Sunday, 300 tests were done. On Monday, 300 tests, and yesterday, 207 tests. So altogether now, the Guard has done 1,000 tests through the drive-through they have in South Omaha, right, kind of across the street from One World. We don't have results back from some of the other days. We have also reached out to Charles Drew and One World and provided them with more testing and said, we actually open up the criteria for testing for your sites so that individuals can go and be tested at those sites, especially those who do not have a private healthcare provider. So Charles Drew has started this week on Monday to test more than 100 individuals. One World has been testing close to 100 individuals over the last 2-3 weeks. So that is available for some of our minority population. Then I also want to do a shout out to CHI on 132nd and Center. They have really been an excellent clinic to work with, so that when we, through tracing, identifying individuals who need to get tested, we are actually being able to call them and get these individuals in for tested. That is great. They have been a community partner that we really want to point out. The other thing is CHI at Cumming Street, which is behind the Creighton campus. They also are now broadening out their testing. And NOAA, the North Omaha Alliance for Health, they also are going to do testing in North Omaha. We are looking for more opportunities where testing could occur. We know Test Nebraska, which is now at the CHI Center, is looking for different sites. And we are working on where would it make sense to move them over time. And so we are looking for that. We are also in discussion with Nebraska Medicine to see if they could do a drive-through sites. We have done some special testing, however, at 2 of the shelters. We tested, I think by now, both shelters 2 times. In the beginning when they had COVID cases, and then the best practice is to test them again, those that were negative, between 7 to 10 days after the first testing. And that is because you really have a very vulnerable population, but you also have a population who moves a lot, and they needed to be able to isolate and quarantine individuals because they have people come into those shelters on a regular basis, which is quite different in long-term care. I just want to point that out because somebody may say, well, why are you not doing this in long-term care? Long-term care is really is a population that remains there. It isn't moving around. It isn't going in and out besides staff. And so the recommendations are a little bit different. I just want to share with you, most of the long-term care facilities have worked with the Infection Control Assessment Program, which is a program that comes out of Nebraska Medicine. That program provides consultation to long-term care facilities in regards to infection control. It looks how these long-term care facilities are set up, what is the capacity for them to isolate and quarantine individuals, and so on. So in many of the long-term care facilities in Douglas County, we have been lucky that one of these teams, which is made up of infection control nurses and specialists who actually are well known around the world, that they have been able to go into those facilities, look at the facility, and make recommendations. They find different things in every facility. Every facility is slightly different, but their recommendations have really helped. They also have gone into meat packing or food production facilities to do the same thing, to look at the infection control practices, the protocols that those facilities have, and really make recommendation to them. And in one of the cases, they have gone back and they have said, we made those recommendations for you, but have you followed up with them? Because, you can make recommendation. If nobody follows up, it isn't doing any good. So really that feedback loop, they have done very well. So we are very fortunate to have these teams here in town. When we look at, I just heard this morning again, and I do think it is so appropriate. If we do not have appropriate isolation and quarantine, if individuals cannot do that because of the way they are set up or their household is set up, it isn't going to do us any good. So we really needs a multifaceted approach. And what we have done, the state of Nebraska has done, is called the Accommodation Project. The Accommodation Project is made up of several things. First of all, there are hotels that have been designated and contracted with in every community. I think it may not in very small communities, but definitely in Douglas County. Those hotels are available for emergency responders, healthcare provider, correction officer, long-term health community workers, so that they can go to work and go home. Instead of going home, they can go to the hotel and they can go back to work the next day, so that they are not mixing with the household they are at. And this has worked really well. We have more than 20 individuals in Douglas County in those hotels. But now the next step is what they have also done. They have said, as we treat healthcare workers, we also should treat individuals who work in industries where it is a little bit where they are at a higher risk. And so at this time, the same hotels are also there for individuals who work in the packing industry. There is a process in place. These facilities need to give lists of workers who really want to stay in these hotels. But so this is all to minimize the transmission from this virus. And then the third component of this project is the UNO dormitories. And you may say, what are the UNO dormitories doing? They are there for the general public, because it may be that somebody cannot go home and quarantine. They are being told by the health department, you should quarantine. And they say, I live in a small household, I don't have the opportunities, or I have a pregnant wife at home, I have risk factors at home, I have elderly at home. So those, the UNO dormitories are available for those individuals. There is a form that people fill out. They then need to fit the criteria, and they can move into those facilities. So I really want to share that. Last, also, we look at the death. How many deaths, unfortunately, have happened in our community? And that's always, to me, a real hardship to talk about. We have up to now 24 cases of death that is COVID-related. That means COVID-related means on the death certificates that physicians and coroners fill out, COVID-19 has been indicated on those death certificates. Doesn't mean that the person died because of COVID-19, but it means it is one of the conditions that are on there. You hear a lot of discussion on the national media about that. The 24 cases that we have are out of a Nebraska total of 132 total cases. So that means actually 18% of the cases we have in Douglas County, which is good. Remember, I said 25% of the total cases we have in Douglas County and 25% of the testing that is going on in Nebraska. But we only have, not only, every case is a tragedy, but we have 18% of the totals. When you look at the age range in our unfortunate population who had to die, 74% are above 65 years of age. 16% are 50 to 64, 10% are 25 to 49 years old. When we look at it at race and ethnicity, 68% of those are in our Caucasian population, 21% in our African American, and 10% in our Hispanic population. When we look at the comorbidities, because we always say, those who have comorbidities are more likely to die from this virus. Respiratory illness is our highest comorbidity, and by that we mean asthma, underlying respiratory illnesses. 42% of our cases have respiratory illnesses. 37% of our cases have renal disease, and 26% have diabetes. 1 out of every 4 who died in our community had as an underlying illness diabetes. This cardiovascular disease, no surprise, 16% of our cases have cardiovascular disease. What is surprising to me, only 10% of our cases have immunological disorders, a suppressed immune system, so to say. That's 10%. Also, only 10% of our cases have cancer as an underlying condition. Let me also talk about something a little bit more positive. That is, we are looking at the cases that have recovered in Douglas County. And right now we have 471 cases who have recovered. And you may say, how is that being determined? That is being determined by a person from the health department who's calling every single person, and we go back about 3 weeks after they have start onset of their symptoms. And we ask them, are your symptoms gone, for example? When they say, well, majority is gone, but I still have this lingering cough, they are telling us that they are not recovered. So then we put them in a different pile, so to say, and we'll call them back. So 471 have said to us that they have recovered. They do not have any symptoms anymore. And from those who have recovered, just kind of a quick breakdown. As we would expect, 58%, more than half of them, are in our 25 to 49 years old. 19% are 50 to 64 years old. Can go down the line. Only 9% of our individuals above 65 years old have said that they have recovered. When we look at our race of those recovered, we see 40% are white, 36% are Hispanic, 15% are African American, and 7.1% are Asians. It's really always good that we are clear with what our data shows. As you have heard, we are very interested, and that was kind of flattening the curve so we are not overwhelming our hospital systems. And what you are seeing is now we are seeing an increase in the burden of our hospital system since we have an increase in our cases. And what you are seeing is that when we look at our medical and surge beds, we are seeing we have 412 beds available in our community out of a total of 1,339. So that is an occupancy rate of 69%, or you can turn it around and say 31% of our beds are available at this time. We are looking at this number very closely, and so does the governor, because we do not want to come to a point where we are overwhelming our system. This is the lowest rate we have seen at this time. When we look at total COVID inpatients that we have in hospital, we now have 137 patients who are in hospitals. 2 weeks ago, that was 74 patients. So we have close to doubled compared to 2 weeks ago. When we look at ventilator use, that's always a good story that I like to tell. We have at this time 122 ventilators that are being used out of a total of 374. 122 out of a total of 374. So you could say we have 250 ventilators available as of today. So that's a nice resource. However, what we are seeing is that 44 of those ventilators are being used by COVID-19 patients, and 2 weeks ago that was 16. So we are starting to see how that increase is occurring. I would like to share with the board just a quick summary about all the different operations that we have around this in the health department. I think that is important for you as a board to know. So we are the recipient of what you call the hub for PPE, personal protective equipment. And I cannot say enough for our staff who has really put together a team who's working on this and breaking down what we are getting from the state. So these orders go into the state. We then receive shipments, and we then are making sure that everyone who requested PPE, dependent on healthcare workers. It has really to be somebody who takes care of COVID-19 patients. Those are the individuals, or have them in their facility. Those are priority filling of this. So we distributed all of it. We seem to be pretty good on PPE in general, and that's also the kind of the thought that the governor has. Every PPE purchase comes from the governor. They buy in bulk. Pretty soon, early on, we have found that that is the most effective way to buy these procedures. Now, I have to tell you, there are sometimes hiccups. Sometimes the PPE that they are purchased are not high quality, and they need to go back. So, we are working through those issues. But at the same time, I also want to share with you, we have had donations in our community from private foundations, and we have given out 70,000 masks for the general population, mainly in North Omaha and in South Omaha. So we are really trying to put our resources in the areas most affected. I want to talk to you a little bit, as I probably don't have to share with you, but it's epidemiology and communicable disease contact tracing that is really at the forefront of this. And those staff members are putting in a lot of work. Epidemiology is doing all the data analysis, and as you can imagine, this is huge. This is a huge project. We are getting so many laboratory reports from different laboratories, and everyone just has a little bit of different interface to make sure that it gets into our data system. And then once it is in there, they are doing an analysis through the SAS program to really try to provide me and to provide the community the data that you all are seeing on our dashboard. That doesn't come out very easy, I tell you. So I just want to tell you how proud I am. Sometimes laboratory results that we are getting, they are not from Douglas County. They are from Sarpy or our surrounding counties, and we need to make sure that the data is provided to them so that they can interview. Contact tracing, I just want to share with you, we have tripled our staff, but retraining from other programs, cross-training. We have had our environmental health inspectors. They all are doing, most of them are doing contract tracing at this time because restaurants have been closed up to about a week ago. Swimming pools are just starting to open and needing some inspections. We have used our STD prevention specialist that has really worked well, as well as our nurses, because the STD clinic is only open at a very minimal rate. And now we have hired also temporary workers from the College of Public Health, and we are training them and really trying to use them. And we had to refer some of our cases to a team from DHHS that is a contact tracing team, because we are getting so overwhelmed with cases. 200 cases a day. That's just very difficult to do. And now the cases also seem to have language issues, and we need to have interpreters involved and so on. So it is taking a time. I want to share with you a little bit about our Navigator program. I'm really, really proud of. That program started last week. And that is really a program when the contract tracers are talking to someone who is now COVID positive and needs to isolate at home. But they may say, it is difficult for us to do that. Or they will ask them, do you have certain needs? And when these individuals says yes, that person will be referred to the Navigator team, who then will make contact with that individual and say, what is your need? What can we do around you so that you can stay home and be safe in this time? The program started last week, and I can tell you the number one issue is that people who need to quarantine or isolate are saying, I need food. Food is the number one issue, and the navigators have a pretty good program in place with Whispering Roots and No More Empty Pots and the food bank, so that they are being delivered packages of food to their homes, so they do not have to get out of it. The number two one is rental assistance. And these navigators then will know what the resources are in our community and refer them to those resources. Another activity that we have had since the beginning is our information line. And I tell you, we have now, our information line is now running 7 days a week. In the beginning, we thought we could stop over the weekend and we could give our call to the United Way number. It is important. The questions that are coming in on our information line are difficult questions. They are not simple questions, well, tell me about the symptoms. There are individuals who want tests. There are individuals who have issues with the direct orders that are out there and want to have a clarification on it. There are individuals who just have family situations that they want to talk about. So some of these calls can take up to 45 minutes. Where it used to be about, I would say about 2 weeks ago, and Sunday can talk about this, there were a lot of people who just were angry. They were angry about the DHM, and they just wanted to have somebody to talk to about it. And now it is more the calls that we are concerned. We are concerned, what should we do? This is the situation we have, and so on. So the information line takes about 100 calls every day. They give me a summary at the end of the day about what are the themes of those calls, what questions couldn't they answer or they need some clarification on. So we have really developed a good system. And the last effort that we have going on is planning for potential mass vaccination, because we are already thinking that could actually occur if a vaccine is being developed later this year or actually at the beginning of next year. So that is going on at this time. Let me just switch quickly over the direct health measures that came out from the governor. And on May 4th, we had 2 of them that are statewide, which are that elective surgeries could be started again in hospital systems, and the direct health measures in regards to churches. That churches could hold services as long as they do physical distancing and with very strict guidelines. But we also had 3 other categories that were specific to areas, special areas. In our area, restaurants could open at 50% occupancy rate, and then a set of guidelines came out by the Nebraska Restaurant Association, how different things should be handled. For example, servers should wear masks. It's not a request, or we cannot actually enforce it, but best practice is that servers would wear masks. One of the recommendations is that there always should be 2 people there, one who handles the money and one who serves the food, and so on. A recommendation is only 6 people around the table, and from a table to table there should be 6 feet. We had a DHM that actually said that hairdressers, beauty salons, barbers, massage parlors could open as long as they enforced the rule of 10, which means only 10 individuals could enter those businesses, excluding the staff. And in those businesses, it was mandatory that the staff and the clients would wear masks. So that is enforceable in those businesses. And the other one that was put in there was daycares. They increased the daycare number from 10 to 15. The reason for it is that if you are opening up businesses, parents need to be able to put their children into daycare, and so it was a necessity. like I said, there were guidelines that were developed for beauty salon, hairdresser, that sector. There were guidelines that were developed for restaurants, and the churches and the religious services, they also developed their own guidelines. So what's going to come up next? I think everyone at this time is trying to think what would the next step be, potentially in June 1. And so a lot of discussions. We have local health directors have a lot of discussions with the governor at this time, with sectors in our community to see how that will go forward. Nothing has been decided yet, so that those discussions are ongoing. I want to share with you just something that that is going to be a challenge for all of us is, I think, how do we open up this economy in a fair way, but also in a way that is protective of public health? So I've spent a lot of hours lately with the school districts because they are really trying to see how can we do this in a safe manner. They really are wanting public health input. I also want to share with you the Omaha Zoo. They have shared with me a really detailed phase 3 plan, how they would go opening up. And they actually wanted to open up last Monday, May 18th, and have agreed after discussion that they would delay opening through to June 1. And I think that's a very applaudable action that they have taken. But there are questions now about sports events, who can we open, when can we open, how can we do this in a safe manner, and large events are coming up too. I just read this morning in the paper, the chamber reported that they have a report that they are putting out for businesses, and I have actually been in consultation with David Brown pretty soon from the beginning, and he has shared the plan with me and the Chancellor Gold, and we have looked at the plan, and it is a very, very, very thoughtful plan, really with public health as one of their main goals. But in that plan, and in the article this morning, he is saying that a lot of the decisions the businesses can make are based on a model that comes out of the Global Center for Health Security. It's called the PRAM model, P-R-A-M, Pandemic Recovery Acceleration Model. I just want to share with you quickly as a Board of Health to give you some background what the model is all about. It actually has potentially 6 different metrics. One of the metrics is the confirmed cases, the positivity, the percentage of positive cases, and the related death. So those are 3 metrics. And then it also has 3 hospital metrics: hospital beds, ICU beds, and ventilators. Mainly what the chamber is looking at are actually the top 3 metrics, the confirmed cases. And at this time, a benchmark that is being used in the model is 10 new cases per day per million, population. So for us, Douglas County, that would mean 8.3 cases per day. So the benchmark is if we would be below 8 cases per day, that would be a really good benchmark that we want to be at. If we are above, he has some increased levels, what that would mean to businesses. The other benchmark when they are looking at positivity rate is 5% positivity rate per day. So at this time, as I shared with you, we are at 11.4% yesterday. So if the positivity rate would be below 5%, that would really get us into the green range, and that would be a good measure to have. In regards to related death, it's 0.17 death per day. For our case, I look at that 1 death a week. 1 death a week is really what we should go for. When you have hospital beds, the model has 15% of hospital beds should be available. In our case, that would mean 185 beds. means ICU beds, 20% should be available, which is 76 in our case, and ventilators, 80 should be available. And then the model is looking at where is our trend going? And then what is our acceleration rate compared to the previous 10 days? The last 3 days compared to the previous 10 days. So those are measures that say, are we at least going in the right direction? Are we still accelerating or not? And so this is a model that the Chamber is using. It's a model that is on the website of the Global Center of Health Security, and it's a model that is really looked at around healthcare coalitions. I just want to make sure you understand this. There are, I think, 6 or 7 health coalitions across Nebraska, and they collect all the hospital data on a daily basis: hospital beds, ventilator use, ICU beds, or so on. So that information is used in this model. For our region, it is the Omaha Metropolitan Healthcare Coalition. That means Douglas County, it means Sarby, it means also Fremont, Washington County included in that. So it's a little bit broader. It makes a lot of sense if you think about hospital systems have hospitals in Omaha, but also hospitals in Sarby County, for example. And they would all share in their resources. So I just wanted you to have that background too. And that's about all I want to report to the board. Do you have any questions for me this morning?
I do.
Yes, ma'am.
Dr. Poor, let me ask a question just in terms of the African American community. We talked about that those numbers are really pretty much reflect the demographics of the community. I guess my concern or my question is that because there's limited testing in North Omaha, and do you have a concern about the amount of testing that's going on?
You know, it's a very good question. I'm concerned. I think let me just say that I think we all want more testing. We all do. I hear it every day on the phone calls. People want more testing. So even though we have provided more testing to North Omaha, it is one of my concerns. It's one of my questions too that I have. So we have actually asked the governor to provide more testing in North Omaha too, as we are doing in South Omaha. I think we all are in the same. We all want more testing.
Okay.
I am a little bit concerned about Test Nebraska, because that is always what is being told. You know, people should actually enroll in Test Nebraska because that is a resource we have in our community. So the more you can do any outreach, I know Test Nebraska has some shortcomings. If individuals may not want to do the assessment online, they may not be able to do the assessment online. So we are trying to see how can we do it better so that people could directly sign up when they come to the site. We have to work through with the governor's office through those issues.
Okay. My second question has to do with an organization in town that up to now has kind of been a headache for the city council, but in the city. But we have a gentleman's club that has been operating, and they have significant numbers of people in their facilities on the weekend, and police attempted to go in and check it to see if they were doing the social distancing and the other things that we want to see, and they weren't let in. I guess my question is, does the health department have the authority to do it in spite of the fact that police can't go in unilaterally by themselves to check? I guess that's my understanding. But I don't know that any entity ought to have the ability to thumb its nose at the health department and police department and others when we're going through this crisis.
Yeah, it's hard. Enforcement of the DHM is really an issue with the governor on the state level. So the Attorney General is looking into that issue as we are speaking right now to see what is really the next step. The Health Department has the authority if it is uh, an infectious disease, a health concern. We do not have that type of information. So I think at this time, what enforcement wants to do is they want to make sure that the DHM is being followed. But we don't have any cases that would say this is a public health emergency from that standpoint. So the Attorney General is looking into this. This is a state issue at this time. So it is moving forward and people are looking at it.
My third and final comment or question is, I've been made aware that there's being sponsored, and I don't know who the sponsor is, but it's being sponsored that it's an all-school get-together for the seniors at Levi Carter Park this weekend. I saw it on a social media post. It was sent to me by the mayor's office in a social media post. And I guess I'm wondering, should we, police as well as the health department, be proactive and do our own social media thing, trying to discourage that, so that we don't have a confrontation between police and others that could have been avoided if we had been on social media saying, counteracting what they want to do and talking about how dangerous that might be.
I think that's a really good idea, and I will ask Phil to. He's pushing out a lot of information on social media, but specific to that, because we had that incident early on, and we don't want to repeat that. So I'm glad I didn't know about it because I'm not on social media, I guess. So thank you for bringing that up.
Yeah, I wasn't on social media either. It was sent to me, and so I said we probably ought to address
Yeah.
it if we can.
Yeah. The more we can do up front to prevent incidences, the better we are off. I agree.
And let me just add my thanks to you and your department and the work that you are doing. And I know Phil is putting out a lot of information. Don't mean to overload him, but we do need to be aware that these things are occurring.
Yes, and those are important. They are timely. They need to be reported. So I'm glad you are. And please, all of you, when those incidences occur, or when you see something that the department could actually interfere or could prevent from happening, let us know, please.
That's all I have, Mr. Chair.
Thank you.
The PPE situation, we're getting people calling here all the time asking us to use money for PPE. Basically, it sounds like we shouldn't be entertaining that. The state should be entertaining PPE.
Correct. So the question is often who is getting PPE from the government, because this is purchased by the governor. And his response is very clearly PPE that is purchased by the government is really the priority is for healthcare workers, for workers in correction facilities, emergency response to a certain degree, but really for those individuals who take care of COVID-19 patients. So that is the highest priority at this time. And I think efforts to provide PPE to other organizations or to community members in general, we need to look for other resources.
I want to delve into this question a little bit, and I don't know, I'm just, and the thing is trying to stay ahead of this number. Omaha is not too different, or Douglas County is not too different, and it's just a mystery to me behind, when we first started keeping track of it, the numbers were a little different in regards to the communities of color, and it's just a mystery to me of why that number has changed so much. I mean, is there any hypothesis or anything you're thinking other than the testing piece? Is it, I just don't know. That thing, I keep feeling like it's a time bomb ready to pop or something. There's just something out there, and I can't believe it's that low a number of people. that's there, particularly because when I look at the screen, and particularly when you look at the African American number, that's below the rate. Because when you look at it in the zip codes, you got the high Asian Burmese population that's there, and I have to think that I'm not seeing people wearing masks like they should, one, and I got to think that that number is just not that low. And every time I see this, every day it goes down. I'm trying to think what's going on. Is there any thought to that somewhere, or any guesses or anything going on in like any conversations with UNMC or anything where their thought might be that other than the testing piece, and that's kind of a mystery.
You know, I ask myself the question often too, but then I think back on these potential waves that we have had. Remember, the first wave was all travelers who came into this community. This is really how it started. I remember we could potentially say the new case, oh yeah, had traveled to here or there. So then at that time, we had really a lot of individuals who were Caucasians, who traveled and came back. The next phase, it seemed to be, we suddenly had outbreaks in long-term care facilities. That increased again. So we saw the 65 years of and older really increase. Then it went for a while. I mean, I remember very well when we had 40 cases in a week or in a day. That was very reasonable. And then suddenly, I thought the packing industries around us had cases and had outbreaks. But individuals lived in our community, and so the virus went back and forth. And then we saw outbreaks in the packing industries also in our community. If you look at it, Commissioner, 50% of our cases are in the packing industry, and 7% are in long-term care facility. So you could actually say it probably has more to do with where the population works at this time. It really seems to be concentrated. And so that is kind of where I am thinking of, because if you look at the positivity rate that Charles Drew has and that One World has, One World has a positivity rate of sometimes up to 40%, where Charles Drew positivity rate, which goes back to the tests that are being done, is much lower. And so I do think it has to do some with the workplace and the outbreaks that are occurring in close quarter, where people really work closely together, and it may be a function of the workplace, therefore.
So is it a fair assumption, so like Monday's gonna be Memorial Day, these restrictions are relaxed, so a little bit, and I don't know how much people are gonna stretch these, but should we be looking to the 2-week out period of June 1 to see if there's some big burst in numbers, being that people may be tempted to get together on Memorial Day? Is that a way to look at this? Memorial Day is going to be a next holiday gathering type piece. Could you potentially have a increase 2 weeks or 3 weeks later around June 1 or June 8? Is that a fair way for me to look at that?
That would be very fair, and I hope that's not what we are seeing, but if we are not careful, and if not everybody is taking their own responsibility in regards to social distancing or physical distancing, not so much social distancing, but physical distancing, and wearing masks and hand washing. Those 3 things are really important, and we cannot let our guard down, I tell you. So I hope we are not seeing increases, but I tell you, there are. It's imminent that is going to happen.
I'm just on your calls. I'm curious what the. So you noted that the line number 2 is food. Is there any conversation about the food supply, being that every time I go in, the meat shelves seem bare, and the price of meat is going up? Are you all delving into that any on these daily calls about what the food social determinant of why food supply is going to do?
Actually, when I'm on a community call in regards to food, and especially also to the food bank. And the food bank had some very alarming signs in the beginning of this. They are seeing their food supply is now increasing and their donations are increasing again. So from that perspective, I do not. What is going on in the grocery store often is an action of how people function. And I do think once they heard the meat packing, there was a little bit this run for meat and so on. But I cannot explain, Commissioner Rogers, why prices are going up in that industry.
No, I'm just wondering if that call with the governor, if it's expanded to that degree, because you got so
no.
many. I'm wondering if some of the health departments out west are talking that.
No,
but
they
okay.
are not. You know, I have to share with you, out in western Nebraska, they have so few cases. I'm jealous with them being on a call every morning and hearing, you know, we had no case last night, or we had one case, and then here come my report with 200 cases, you know, in a day. So,
Okay. All right, I think that's all I got.
Dr. Ford, I can turn it on.
When it hits, hit the right when it's red.
Okay, there we go. You said we had 2,570 cases, of which 471 have recovered. Is the health department following up on all of those 2,500 cases?
we are planning to, yes.
Okay. And we have a mortality rate of about 1%, and the state has about the same, just a little bit over that. Would you remind us what perhaps the national mortality rate is, if you're aware of that?
You know, I think I can tell you the
Okay.
national average. I've heard, you know, some communities as New York has a much higher rate. So I think we are, when you look at our rate, we are, from a death perspective, the data is pretty good in our community.
Okay. And when 75% are age 65 or over,
Yep.
with underlying conditions.
Yep.
And then my last question is, that's a lot of statistics and numbers, and thank you for all of that. Is this information and data being reported consistently across the state by the various health departments?
You know, it depends. The data reporting is varied. I would say, and I'm just going to say it, I think we have the best dashboard there is, because we are transparent. We try to really look at the data from a race ethnicity standpoint. And what I see even on the state data dashboard, they do not have that type of specificity. So not all of them are reporting in the same way and are reporting the same variables. And I have to say, I have to give credit to some of the smaller health departments who have had outbreaks. They are just overwhelmed at this time and do not have the capacity to report it. But yeah, I have gotten calls from the national media who is saying, you know, we really appreciate your dashboard, and what can you do to actually convince the state to also improve their dashboard?
Are they in a position to do the type of thorough follow-up that our Board of Health is doing as far as the cases and following that, the outstate boards?
You know, that is a best practice, and through the governor is proposing to have 1,000 contact tracers, and those contact tracers would be provided as assistance to all local health department. They have about 268 individuals in state government who are now trained to be contact tracers, and those are being lent out to small communities who are overwhelmed at this time. So yes, potentially every community with every case is doing the same thing. The next phase is that the governor is actually thinking of to have, because everybody needs to go back to their normal job, so to say. So those contact tracers, those 268 individuals, may not be available for a longer time. So he's now looking at providing contracts to certain private businesses who could do that type of work. And so yes, it is very contact tracing is probably one of the most important things you can do at this time, because only then you isolate them early, then can you stop the spread of the disease.
Thank you.
On the vaccination plan, are we going to revisit potentially dentists helping out, or is that something, how far have we gotten onto that, the mass vaccinations?
Could you repeat that again?
Are we going to look at dentists helping with the mass vaccinations? I know we
I,
look-
I think we have learned a lot from previous years, and so I do foresee, yes. And I will share the plan with the board once we have it a little bit worked out, a little bit better, and get input from you. Yes,
Thank you.
you're welcome. Yes, Celine.
Good morning, everyone. Dr. Adipur, I first would like to thank you on behalf of South Omaha community. I would like to thank the Douglas County Health Department and the National Guard for coming to our assistance. I have talked to several community member leaders that are very grateful for them setting up the testing site in South Omaha. I have been on site doing interpreting, and the community members are just very grateful for that service. One of my concerns with this is, as you might have already answered, is that we have contact tracers calling these people with their results and giving them guidance if there's a positive result. My concern would be, are there contact tracers that are bilingual as well, contacting this population in South Omaha? If you.
Most of them are, not most of them. We have, let's say, we have bilingual contact tracers. But sometimes just from the name, it is very difficult to determine that that is somebody who only speaks Hispanic, for example. So we are trying to do our best. We are using also the language line, and it has worked very well. But that's what we are looking for. We are looking for more bilingual contact tracers because there is a great need for it. It's not only Spanish, it's Karen and other languages now that we are running into that we really need to have much more interpreters about, yes.
And if someone is interested in applying for that position, where is this being published?
Well, we are not publishing positions at this time, but we have a person who is taking this all in. It's our division chief, Carrie Kernan. She is the one who is really organizing, the logistics person who is organizing staff and so on. So I would say probably, do you have her email address, or I can, Sunday can provide it to you.
Thank you.
Yes.
My last question would be, are we planning to also maybe move the National Guard around town, maybe North Omaha area or Bellevue area?
That is a good question. Bellevue, of course, is Selby County, so that would have to be. The South Omaha has been promised that the National Guard would stay there for 2 weeks. However, what we are seeing is there may be a time that we have less requests or less people coming to that site, and so then I would want to have a conversation with One World, how comfortable they would be to let them move around. You know, it's a big endeavor, as you have seen, and I really need to tell you how thankful I was when I saw a picture that Phil posted and shared with me, because you were at the site on Sunday. So I really, really appreciate that. We have heard from some other communities that they are not feeling so comfortable with having the National Guard there because there are some issues, maybe history or something. So we are working through that and see how that would work. But for the time being, it is planned that the Guard would be there for 2 weeks, and then we need to find some other sources because like you said, Test Nebraska, however, is going to move around in the in the region. So they are staying in this county and hopefully move around. They are now at the CHI Center, but I would like to see them more in middle of town and also in some of our western smaller communities in West Douglas County, like Valley, Fremont, and so on. Those individuals really need to have access to it too. But we are in discussion with North Omaha how that would look like.
Wonderful, thank you.
Yes, Jean.
Again, thank you for your department and all the work they're doing. It's been amazing. So my questions are, and I'm sure for any parent of a school-aged child is, and you had mentioned you've been working with school districts on timeline, et cetera. Do you have any indication as far as even just when they may make a decision and what kind of conditions need to be in place before they feel comfortable making a decision?
Yeah, those are all unknowns at this time. They are looking at what benchmarks could they look at and how would openings look like for them. So those I couldn't give you any dates at this time. They are really more thinking what phases do we need to look like. They are starting to think about what supplies do we need to have so that we really could open this in a safe manner, and a lot of thoughts. And there are some guidelines that the Department of Ed is going to put together, and I think those should come forward in about a day or two or by the end of this week or next week. And it is under those guidelines that each of the school districts is going to work in. So yeah, we don't have dates yet.
I think that's it.
Thank you.
for Do you have anything? Yeah, I guess your health director report and everything was done in Allen? Okay, all right. Does anybody have questions regarding any of the reports that were submitted for the board to read? Okay, Dr. Poor, I may have one just of interest. I guess I'm not, I was curious in reading this WIC report. I'm just curious, what are we doing with Nebraska Methodist College with WIC? I guess I never picked that up in the past. It says, for 685 children were screened in the Douglas County WIC clinics, while 116 were screened by Nebraska Methodist College at 8 schools. And I thought we were doing totally all that. I'm just curious about that. And if not, I can, follow up with Carrie about it. But that was just something curious that I hadn't noticed before.
We always had a contract with Methodist Nursing College, so I foresee, I don't know the exact what is going on at this time, but they have done lead testing for us for some time.
I think you mentioned a little bit, but I'm just curious, now that some of these restaurants are opening, are we kind of doubling? Are we having any role in compliance or anything like that? Are we getting calls about that, or is this totally in the police's hands still?
So do we have any role in compliance? Not so much in I think what our role is in education, educating about compliance. And Joe Gobb has been out there now for the last few days really to meet with restaurant owners and say, these are the guidelines that you really should follow. They've been put together with your sector expertise and so on. So that's what he's doing. He's also going out on complaints, because now we are starting to get, of course, as you can imagine, a lot of complaints from some of the individuals who are visiting these restaurants. And then he's also starting to make sure that when individuals are identified positive in restaurants, that quarantine and isolation is being handled appropriately, especially if you have a server who comes down ill. So they are starting on a plan to how do they really go forward in regards to going back and inspecting restaurants again now that they are starting to move that up, and they're working together with Dr. Fix on that plan.
Okay, thank you. Anybody else? Okay, we're down to the committee reports. I don't know of any, but let me note, Dr. Ford and I have been having a conversation, and I don't know if the board recalls at one point we had talked about this ex officio position to add one for housing, and this was a while back, but in conversation, there's probably 2 more that we'd like to propose to the board to add, and I'm gonna work to bring, I guess, some names to the board. One probably from education, from a school board, and the other from housing. Before, if you recall, we did have participation from the Omaha Public Schools, we kind of split the baby with that when Jeannie was in her old role. And now that she's transitioned to a new role, we're talking about probably bringing ex officio and to have that perspective and kind of complete that element in the social determinants piece, but particularly the housing, because as you noted with Dr. Poore, said that's in that top piece, and there's a lot of discussion happening in that respect. So if anybody doesn't have anything, we're gonna try to see if we can add those two ex officios. Okay, with that, there's no need for executive session. Anything else? Is there a motion to adjourn? There's motions and second. Roll call.
Wade. Gray. McNally. Rogers.
Yes.
Espinoza. Weiss.
Yes.
All right. See you all next month. Thank you.